Hi everybody, welcome to this lower body prenatal workout today with Kendra Mill. My name is Grace, I'm a pre and postnatal specialist personal trainer. I'm also a mother of one son. I teach classes, pre and postnatal exercise classes with fabulous Sweaty Mama Beckenham. Today, before we get going, I just want to talk about some safety points with prenatal training. So, if you were already exercising before you got pregnant, it is perfectly safe to exercise the whole way through your pregnancy, just making some adaptations. As we go through the video today, I'm going to talk through what those are. In your first trimester, so that's weeks 1 to 13, you can exercise pretty much as you were before. You just got to work through things like morning sickness or fatigue, things like that, how you're feeling. Second trimester, weeks 13 to 26, you're going to want to adapt slightly because of growing bump. The big rule to remember here when you're exercising is try and pass the talk test. So you don't want to get so out of breath that you're not able to talk. So if that happens at all today, then just try and make sure that you're taking that intensity level back. I will remind you. Same here for trimester number 3. In trimester 3 as well, you're going to also want to make sure, and trimester 2, depending on how big your bump is, that you're not lying on your back, you're not lying on your front, okay? We've got no crunches in these trimesters. But it doesn't mean that we can't work these tummy muscles, because keeping our abdominals, those deep core muscles, nice and strong throughout our pregnancy, it's going to really help us out with things like giving birth and also your postnatal recovery. So to get started today, you're going to need a mat, you're going to need some space. You can put shoes on. I've chosen to wear socks today. It's up to you. Get your trainers on if you prefer. Sometimes it's quite nice to just have your feet flat so you can really ground them into the floor. Options have some dumbbells, light dumbbells, some resistance bands I'll be using. These are super cheap, you can just get them off the internet. And also make sure you have some water. So when we are pregnant, our body temperature does rise. So it can become very easy to overheat. So make sure you're drinking lots of water, plenty of water throughout, and also take your rest whenever you need to. So even if I haven't stopped, please just take your rest whenever you need. Okay, I think that's everything, and we can get started with our first round. We're going to begin with a warm-up today. It's really important that you warm up before you exercise, especially when you're pregnant, because you want to bring your heart rate up nice and gradually before you go into your main strength and conditioning work, okay? So we're going to start with squats. So our feet are going to come hips width apart, toes slightly turn out. That's going to be better for your hips and better for your knees. And we're just going to come as if we're sitting onto a chair, squatting down and standing up. So if you want to, if you are in your second and third trimester, you can actually sit onto a chair for this if you find that more comfortable, if that's better for your back, better for your posture, yep? So we're going to do here about 10 to 15 reps, just bodyweight squats. Don't mind where you put your hands, we're warming up those muscles everywhere. Put them on your hips if you prefer. Here. So body weight to start, and then if we want to, as we get into our first round, you can grab hold of those dumbbells, grab hold of that resistance band, just make it a little bit harder on the legs. We're going to do 2 more. 2. And 1 more. Down, squeeze your bum as you come up. Perfect. Keeping those legs wide, you're going to step them a little bit wider. So wide leg position is better for second and third trimester because it gives you a little bit of room for bum. And we're going to come into a lateral lunge. We're going to take the arms out to the sides. Bending down, try and reach towards your toes. Don't worry if you don't touch your toes, guys. That's not the aim. The aim is to strengthen and stretch through the adductors and the abductors. So that just means the inside and the outside thighs. Working through your bottom, keeping your back straight. Inhaling, coming down. Exhaling, squeezing, coming up. So the other thing here for my prenatal ladies is to keep breathing. Do try not to hold your breath because we don't want anybody to get dizzy or feel lightheaded, which is also really common. So if that does happen, just sit to the side, grab some water, take a break for as long as you need to. 2 more here and 1 more here. Good. We're going to take our feet now round to the side. So we're going to rotate the feet facing one direction on your mat. Your feet, we're going to do some lunges here. Actually, you want to stay fairly wide, so about hips width apart. You're not walking on a tightrope. Hips width apart and quite far back. For second and third trimesters, you might want to hold onto the wall for balance here. We're just going to come into some lunges. So coming down towards the floor, exhaling, squeezing, coming up. Inhaling, lowering. Exhaling, coming up. So again, don't worry if your knee doesn't touch the floor, this is just the warm up. Come as low as feels comfortable, exhale, lifting up. So on that exhalation, you want to think about squeezing your bottom, driving up from the floor, pushing down through your front heel. Let's do another 3, another 2, and one more, breathing in. Good, we're going to turn our feet around to the other side. We're going to do one more exercise of our warm-up after this. So remember, squeeze that bottom, chest up nice and tall. You can think about pulling belly button in towards the spine, yeah? Even when you're pregnant, you can still work those core muscles. You just want to keep them engaged. So lightly drawing in, giving baby a big hug, yeah? So pulling in nice and tight. Hands on your waist or to the wall. Let's do another 3. Perfect, for 2. Good, and the last one. Perfect, come back to the center. We're going to take the feet in. We're going to do some hip openers. So we're going to open the leg out to the side and then coming back into the center. So our hips take quite a bit of strain during pregnancy, yeah? So you can get pelvic girdle pain as all those ligaments and tendons expand. Our hips slightly pull apart to make room for baby. So they are, there is a lot of tendency to get a lot of tightness and a lot of pain here, yeah? So we want to make sure that we're warming up our hips as much as possible. Good, one more on this side, and then we're going to go to the other side. Hands to your waist, or to the wall if you need to. If you feel your hips clicking, don't worry about it, as long as there's no pain. It's just where you're getting that little bit of tightness. So this should really help, guys, yep? We'll do another 3. Remember to breathe. 2. Good, and one more. Perfect, just pad through the feet. Okay, so grab your water, your weights, your resistance bands, and we're going to get going with our first round. So we're going to get into round 1. You're going to need your resistance band. So I've got a heavier weight and also medium weight, whatever you feel more comfortable with. We're going to pop it on around our thighs, so just above your knees. We're going to begin with squats. Again, if you have got your dumbbells, that is your option. I'm just going to start off just with 1. I would say for your first round, go a little bit lighter, and on your second round, you can increase the intensity if it feels good, yeah? So always start off at a lower level, and then you can increase the intensity. It's better to do that, rather than go too heavy, and then you know, you're too knackered, basically. So we're gonna hold onto that dumbbell, nice and tight to the chest, feet hips width apart. We're gonna come down 20 squats. So we're gonna come down nice and low if you can. Big squeeze coming up. So remember, take the hips, the legs slightly wider. If you have bump, you can also do this sitting down to a chair, yeah? So we're gonna come down, 4 reps. 5, nice and easy today. We're gonna be doing 20 reps of everything. So just think, 20 repetitions. 7, exhale as you come up. Inhale, exhale, 8. 9, big squeeze at that bottom at the top. 10, we're going to do 10 more here. So make sure you're pushing away against the band for me, yeah? Remember, if you don't have a dumbbell, you can grab hold of any kind of weights or don't use weights. 8 more. Exhale coming up. 7. Option here as well is to sit down onto the bench. 4, 3, 2, big squeeze, and 1. Well done. Following on from that, we're going to go straight into kickbacks. So we're going to stand with one hand against the wall. So here we're going to double up, targeting that bottom muscle again. One leg, we're going to hinge slightly forward so you can hold onto the wall. Maybe you have a chair in front of you to balance. We're going to kick that leg straight back, squeeze at the top for 1. 2, big squeeze. 3, so we're hinging the chest slightly forwards. But again, controlling through your core muscles. So try not to let your lower back arch too much. Keeping your back straight for 2 and 1. Good. Okay, so remember to take off your layers where you're getting hot. I've already taken mine off because it's hot in here. So we're going to go for those kickbacks on the other side. So making sure your knees are slightly bent, pulling your abs in, hinging forward slightly. We're going to just kick back here, the other direction. Yeah. So 20 reps on this side. Pulling belly button in, thinking about squeezing your bum as you kick back, straightening the leg. So again, don't worry about getting that leg too high. You just want to kick back here, yeah? 7, 8, 9, 10. 10 more here. 10, 9, good. 8, so you might feel it through that standing leg, that's normal. 4, and breathe, 3, 2, and 1. Perfect. Okay, we're going to take the band off now. Second exercise, 20 repetitions. We're going to do our reverse lunges. So I prefer to have one weight for this. You can absolutely use 2, or again, like I mentioned at the start, just body weight. If you're third trimester, you might want to take the intensity down with this, just a body weight exercise. So we're going to step to the front of our mats, feet hips width apart. We're going to step one leg back, so your same leg as the hand that you're holding the weight. So I'm going to go my outside leg first, we're going to step back into a lunge. So carefully, again, hold on to the wall for balance if you need to. We're going to take the chest down towards the floor, and then we're going to step back up. So we're coming here. Back stays nice and straight and strong. Push through that front leg. Here, drive it up. So you're driving up through your front foot heel, yeah? You're not hopping through your back leg. 5. Exhale, coming up. 6. So again, if you're in your third trimester, you might want to take this super slow. That's absolutely fine. You don't have to do 20 repetitions. Any exercise that you can do towards the latter end of pregnancy is going to be really beneficial, yeah? Just keep yourself moving. Remember to stay hydrated. Remember to pass the talk test. All these exercises are safe for any trimester, so you don't have to worry about anything like that. Just listen to your body, guys. 2. We're going to go one more on this side. 1. Good. We're going to switch legs. Switching sides. So make sure you take the weight into the opposite arm, stepping the opposite leg back. Nice big step back to begin. We're going to take the dumbbell down towards the floor. Exhale, coming up. So remember, keeping the belly button drawn in. Exhale as you push up from the ground. 3, 4, nice deep breaths. 5, so we're going to go for 20 reps. You can do 10, you can do 15, you can do 12. Just as long as you're moving, getting those lower body muscles firing up. So working our glutes here predominantly, working our quads, the muscles in the front of the legs. Good. 6 more. 6. 5, you don't have to go as quick as me. 4. 3. That's it. 2 more. Perfect. And 1 more. Good, well done. Drop your weight. Lateral raises. This is our next exercise to go with those lunges. So we're going to work here the glute medius. As lunges, you work your glutes, big muscles in the back of the leg, and also your thighs. So you may wish to hold onto a wall. We're going to be using one leg here, bending that standing leg knee, pulling your abs in. We're going to lift the leg straight out and down. So we're kicking straight leg out to the side and lowering down slowly. 4, 5. You can do this with a band if you wish, but trust me, it's hard enough without one. Don't worry about getting that leg up too high. 9 and 10. Good. 10 more. Keep breathing. Really important to breathe the whole time so you avoid any lightheadedness. 5, 6, 7. Good. 8, 9. Well done. 1 more. 10. Good. We're going to switch legs straight away. So transfer your weight over nice and carefully. Lifting that leg out to the side. 20 reps. Push your big toe down into the mat for balance. 4. Big squeeze at the top. 5. Keep that leg straight. 6. Good. 7. Well done. 8. Big squeeze. 9. Good. 10. Remember, you can hold onto the wall if you need to. 10 more. 10. 9. 8. 7. Excellent. Almost there. 5. 4. 3. 2. And 1. Well done. Give those legs a little shake out if you need. We're going to get our bands again. Good mornings is our third exercise. We've got 1 more exercise to go before we go around in that circuit again. So hopefully you're feeling a nice warmth in the lower body. Not too much intensity. Remember, you can increase it or decrease it by adding the weights, the bands, or taking them away. Good morning exercise next. We're going to take our feet hips width apart. If you can, you take your hands up to your temples. If that's too much, if that's increasing your heart rate too much, just take them down to your hips. With this, we want to keep our back straight, our legs straight, and we're going to hinge the hips back, so bum back. Once you feel that tension, we're going to lift straight up. So we're going to come down towards the floor. Exhale, squeezing up. So you really squeeze your bottom at the top. Slightly tuck your tailbone under. 3. So you should feel this, guys, on your hamstring now. Yeah, it's hitting the back of the legs. 20 repetitions here. Remember, this is your workout, so you can change it as much as you need to, yeah? Coming down, squeezing, coming up. Good. 9. Excellent. One more for 10. So as you come up, think about squeezing your bottom, lightly pushing your hips forward, but not massively pushing them forward, yeah? So it's a little tiny movement forward. This one's great for the muscles in your back, your postural muscles, for your glutes, your bum muscles, and also your hamstrings. Nice, last 4. Good. 3. 2. Hinging coming up. And 1. Perfect. So our exercise to go with those good mornings, we're going to do some standing abductions. So that's going to work our glute muscles again, those big muscles in your bum. Standing by a wall, holding onto a chair for balance. We're going to bend the knee this time. So bending your standing leg, pulling those abs in, squeezing through your bottom, bending the knee. We're going to lift it up, out to the side. 2. 3. So this time you want to get that knee as high as you can up to the sky. 4. 5, big squeeze at the top, so you should really feel it in that bottom muscle, especially after all those exercises that we've just been doing. So front on, if you want to have a little look, I would suggest holding onto the wall or holding onto a chair. 8, 9, 10, you've got 20 reps, 10 more. 10, get that leg up high, squeeze your bum. 9, 8, 7, really nice. 6, 5, holding on for balance. 4, 3, 2, 1 more, 1. Good. Woo! Straight away, we're going to switch sides, okay? So, bending that standing leg, pushing your big toe into the floor for balance, bending your knee, lifting up, big squeeze at the top. So, this one, don't worry about getting that leg too high again. Just work to where it feels comfortable. If you feel yourself getting out of breath, slow it down, okay? Take your time. 9, and just breathe the whole time. 10. 10 more. 10. Woo. 9. Feeling the burn now. 8. 7. Big squeeze. 6. 5. 4. Almost there. 3. 2. And 1. Oh, well done. We're going to leave that band on. We've got 2 more exercises to go just to finish up today with this lower body. We're going to get that heart rate up a little bit. We're going to do some crab walks. Keeping your band on if you want to. If you want an option, take it off. We're going to come down nice and low, starting at one end of the mat. Into a squat position, we're going to step to the side. 1, 2, so we're stepping wide, stepping narrow. Then we're going to step forward and back. 1, 2, step it forward and back. With your hands, again, I don't mind what you do with them. If you really wanted to increase the intensity, you can hold onto that dumbbell. Forward and back. Holding onto baby, maybe you have another little one. Forward and back. That's 4. We're going to do this for 10. We've got 1 last exercise to go. 6. Breathing, breathing, breathing. We're going to get our heart rate up here, but I still want you to control it. So nothing too much. Good. Keep it going. Excellent. There's a cat coming to say hello again. This is a problem with working out at home. Excellent. 2 more. Back, back, side to side. Well done. Keep it going. Last one. Good. Step it forward and back. Well done. Whew. Give yourself a moment. We're going to come up to squat again. We're going to come deep squat up onto our toes now. So working through the calf muscles. So we're going to squat down. Exhale, standing up, lifting up onto the toes. Squatting down, lifting up, straight up to the toes. 3. Try and go quicker on this one if you can. 4. 5. Good. Down low. 6. Good. Down low, up onto the toes. 7. Try and keep those heels nice and strong. 8. 9. 10. 10 more. Finish strong. 20 reps. 8. Good. Remember, you can go slow if you need to. Yeah, slow if you need to. This is the last one. 5. 4. Straight up into the toes if you can. 3. 2. And 1 more. Woo! Well done. Give those legs a little shake. Wiggle that band off. Nice and carefully take it off. Well done. We're just going to come now into our cool down. Well done. We're going to have a very quick stretch and a cool down. That was our prenatal safe lower body workout. I hope that you enjoyed it. So we're going to come up to the wall, stretching out through the quads to begin. So we're going to hold onto the foot, bringing the heel in towards your bum. If you struggle with this, you can get something like a resistance band around your foot, or sometimes I used to use like a dressing gown cord or a belt, something like that. Holding on here so you can gently bring it up towards you if you can't reach your foot. I know sometimes it gets a little bit tougher. 2, 1, good. Release that leg. We're going to come around to the opposite side, so holding onto the foot, hooking something around that ankle if you struggle to get to the mobility in the front of your legs. Bending through that standing knee, squeezing your bum, pushing your hips forward, and taking nice deep breaths. So just letting your heart rate return down nice and gradually here. Excellent. 2 more breaths, 2 and 1. Perfect. If you've got a sofa, a table, a chair, something to pop your foot on, or you can just do this on the floor. We're going to take one leg up. We're going to hinge the hips forward. Just get a little bit of a hamstring stretch. So this one's quite nice to do prenatally because you can leave a little bit of room for bump here, taking the toes out to the side and hinging forward. So you're not trying to bend over that leg or you don't have any room. You can just simply hinge forward here. There's plenty of space for bump to have that little hamstring stretch. Good. Slowly coming up, changing to the opposite leg. Well done, hinging forward here. So again, leaving plenty of room for bump, so we're not squashing anything. Feeling that stretch through the legs. For 2 and 1. Lastly, you're going to need a chair. We're going to stretch out through your glutes. This is a nice alternative to lying on your back. We're going to take one foot across the opposite knee and then very gently just think about pushing that knee down towards the floor. So not really pushing, just easing that knee down. You should feel the stretch all through your hips, through your glutes. If you want to make this harder, you would bring that knee up towards you. So if you're sitting on the floor, that is a good option. If not, we're just going to stay here. Good. Slowly switching sides. This is a really nice adaptation for that traditional kind of figure 4 stretch for your glutes, where you're lying on your back, pulling your knees towards you, which you want to avoid doing in the 2nd and 3rd trimesters. Brilliant. Just easing that knee down. 2 and 1. Perfect, guys. Well done. Thank you so much for joining me. That was our lower body prenatal exercise program.